Welcome back. A new COVID variant is discovered, and this time it is a double mutant type. What does that mean, and what do you need to know?
Plus, the CDC updates its guidelines on what you need to do to keep your house clean. We're joined by Dr. Leo Lee once again. He's an infectious disease specialist with Beverly Hospital. He's going to give us some answers this morning. We appreciate it, Dr. Lee. Researchers have discovered that new double mutant variant. That sounds very scary. What do we know about it, and is it more transmissible?
Right. Actually, the double mutant variant was actually first described in India last month. Stanford researchers actually reported that they isolated one early this week. And what the mutant does is actually has two mutations. It's actually the first time it's been noted in the COVID virus. Basically, one mutation is very similar to that noted in the South African and the Brazilian variant. And the other mutation is very similar to the California variant. Both of them occur within the spike protein region, which allows the virus to attach to the cell. And at least based on our knowledge of each individual variant or the mutation, it seems like it makes it much more transmissible. So the concern is, with the virus having both mutations, that they become even more transmissible. In fact, that current variant right now, which is reported in India, it seems to be fueling the surge that we're seeing right now.
Okay, and Dr. Lee, as more people get vaccinated, there are more questions about what you can do and cannot do. The one question that really seems to be coming up a lot is, do fully vaccinated people, which we now have, still need to wear those masks around others who are not vaccinated? Is there a clear answer to this one?
Yes, there is. Actually, the formal recommendation right now is for individuals who are fully vaccinated. And that basically means it's been more than 2 weeks or more since they received their second dose of either Moderna or the Pfizer vaccine, or 2 weeks or more since they received the single Johnson & Johnson vaccine. They are considered fully vaccinated. In those instances, they can actually interact with other fully vaccinated individuals indoors in small crowds without masking or social distancing. If one is also fully vaccinated, they can also interact with a single household where there are unvaccinated individuals. It's felt to be a low-risk activity as long as that household doesn't have anyone who's at risk for a severe COVID infection. So you can do that. So that's one of the perks of actually getting vaccinated.
Oh, that's good. That's good, Dr. Lee.
Yeah.
Also, the CDC is updating its guidance on cleaning everyday household surfaces. And now they say in most situations, a thorough scrub with soap and water, that's going to be fine. So that is, of course, with no known COVID exposure. What's your take on that? And do we still need all of those wipes and those high-powered cleaners?
No. We've learned a lot in the last year. Previously, we thought that deep cleaning was essential to get rid of viruses and bacteria and to decrease your risk for infection. We've actually found in the last year, science suggests that your risk of actually picking up an infection from touching contaminated surfaces is less than 1 in 10,000. So what they say now is for anyone who's not sick, if you've not had someone with COVID in your household, a simple cleaning with a soapy or detergent-based solution or a product, it's more than sufficient. Now, if you have someone who's in your house who's sick, or if you've had someone who's had COVID within the last 24 hours within your household, they do recommend that you both clean and disinfect. And there's a big distinction. When you're cleaning, you are just removing surface debris and dirt. But in doing so, some of those products may actually help denature the bacteria and also viruses. And so you remove part of them. And in doing so, in decreasing the amount on the surface, you decrease your risk for infection. But the disinfectants actually will kill the viruses and the bacteria on the surface. So for everyday things, for light cleaning, you can actually just clean with soap and water. If it's been more than 24 hours since someone's been in your home, you do not need to disinfect. You can just clean with a product. And if you actually wait up to 3 days, you really don't have to do anything. You don't have to worry about picking up infection that way. You don't really need to disinfect. So it is important, to keep that in mind. The other thing I want to say about the disinfectant is it's important that you use a product as instructed. If you look at the labels, they will tell you what the product works against in terms of viruses and bacteria. If you use those products, make sure you wear gloves. Use them in a well-ventilated area, and basically don't mix products as well too. It's also important to make sure that you leave the products on surfaces for a given amount of time because that's how they work. So make sure you read the labels.
Yes, very good. Dr. Lee, thank you so much for sorting all that out. We can breathe a little bit of a sigh of relief at this point. And
absolutely.
Don't have to clean the house so well.
That's your excuse.
Dr. Lee, thank you.
Appreciate it.
Have a good weekend.
Thank you.
Better safe than sorry, right?
Right. Exactly.